Our family is very musical. My brothers, I have two brothers, one plays the guitar. He's given me a hand-me-down and he's taught me the basic chords, and I'm learning how to play the guitar now. My name is David Winfield. I found out that I had prostate cancer several years ago. My dad had prostate cancer. His physicians had told myself and my brothers to have regular yearly checks of our prostate gland, and that required a PSA blood test. It's just a blood test. It's one tube of blood, and they test the PSA, the prostatic specific antigen. The doctors could not feel anything in the prostate, but because of the history of prostate cancer with my dad, they recommended a biopsy. It was a Friday afternoon. The doctor had given me a call and told me that 7 of the 12 biopsies had cancer in them. What went through my mind was that we'd have to start treating this. I've worked at MedStar Franklin Square Medical Center for 40 years in the operating room. I've seen quite a few patients that had prostate cancer. The treatment options then were surgery to remove it with an open procedure. The options have changed through the years and have really improved for the patient to the point where the surgery can now be done through little puncture sites using a robot, and then the radiation now is much more precise, it's focused, and it has very little damage to the tissues around the prostate gland. We had to know the diagnosis. To have a diagnosis, you needed a tissue sample. So the tissue sample was done in my doctor's office. It was a local procedure. It didn't have to go to sleep. It was not very uncomfortable. Actually, he did very well. I felt no discomfort at all. And after that, when he found out that the cancer was there in the prostate, then we discussed our treatment options. Dr. David Perry is a radiation oncologist, so he deals with any sort of treatment options. It could have been external beam, Cyberknife, seeds. That's the type of procedures Dr. David Perry would do. Well, having worked at MedStar Franklin Square Medical Center for 40 years, I was very familiar with the doctors that would be providing my treatment options. I just felt very comfortable working with Dr. Perry as deciding that the Cyberknife was the treatment that I would choose to have for my prostate cancer. I went for the actual treatment, which was just one treatment a day for about 45 minutes, and that's 5 treatments in 1 week. Just had to lay very still. There was no anesthesia. It just was a matter of walking into the area. They would position me, you put your favorite music on, and they would treat you with the Cyberknife. Very easy, very simple. There was no pain during the treatment. Cyberknife was definitely the treatment option that worked for me.